Hello, YouTube world. This is Robbie Williams, and welcome back to Rebirth. I want to say hello to my family, my friends, colleagues, viewers, subscribers, and to say Happy New Year. We're in 2021. Today is the 3rd. And you know, I am blessed. I feel good about this year. Condolences to everyone that lost loved ones in 2020. But I just would like to say that we're moving forward in a new year. And this is my first video of 2021, so let's get in it. Today's topics are two, and we're going to talk about the major concerns in health in America for 2020 going into this year. And we also want to talk about maintaining good health and well-being, preventive health. So to start it off, let's talk about the 4 major concerns that we had in healthcare last year, because everybody was focused on the coronavirus, and rightfully so. But we also had other things going on other than just the coronavirus. We had heart disease, which is the #1 cause of death. And we had the other, this is cancer. So 1 as heart disease, #2 as cancer, but guess who came in #3? And that's the coronavirus. Within 1 year, the coronavirus eclipsed everything else and made it to #3 on the charts. And that is powerful, because what this virus has done has really blown the minds of millions of people and a lot of healthcare professionals. So let's talk about statistics, and let's look at some numbers right quick here. When we talk about the 4 major health concerns in America, the most common ones are, 1 is heart disease. Last year, this is an estimated number, around 660,000 people died due to heart disease. And by the numbers, when we look at it, the CDC goes with by every 100,000 people, how many pass away due to a disease or illness or even accidents. That's how they look at it. So according to the heart disease category, we had a total of 650,000 to pass away, which leans towards 100 out of every 100,000 people, 165 pass away due to heart disease. And these problems basically are diseases that affect the cardiovascular system. Okay? Cardiovascular disease includes heart disease, stroke, high blood pressure, and other problems that can affect the heart and blood vessels. So we need to do what we need to do as individuals to focus on our health and cardiac health, so that we can start getting with our physicians and making sure that we're doing what we're doing in order to have improvement on our health in that area. The second one I've already mentioned was cancer. Now, cancer came in not far from the numbers of heart disease. We had 580,000, like I said, estimated number, 580,000 people to pass due to cancer last year. And that's looking at for every 100,000 individuals, 150 passed. Now, when we ask ourselves about cancer, we want to know the cause. Everybody want to know the cause. But there are different reasons for people to have cancer. UV rays can cause skin cancer. So people that love to go out to the beach, love to do things in the summertime, you have to be careful about UV. That's the reason why they want you to use sunblock. That's one. Drinking alcohol excessively. Let me put that word in there because I know some people are going to say, ain't nothing wrong with excessively drinking alcohol. They found that people got cancer from hair dyes. Check your hair dyes. Whatever you use, you want to check. You want to make sure the ingredients is okay for you. Always check the label. That's what we always say, check the label. Diesel exhaust fumes. Something else to be a little bit careful about. Formaldehyde, asbestos. You have family cancer syndrome. We have people that get it because, guess what? It ran in the family. We like to say, cancer runs in my family. DNA. Bottom line. Generational. And various uses of tobacco. That's our number 2. That's what placed at number 2. And guess who came in number 3? Coronavirus. Coronavirus hit the scene back in 2019, around December. That's when the noise went there coming up about the coronavirus, another form of SARS. It hit by the end of this year, placing number 3 on the charts. 350,000, estimated numbers again, people passed away in America last year from the coronavirus, COVID-19, or SARS-CoV-2. So, what are we going to do? Because we know that this is a disease that affects the respiratory system. So we need to start doing things to aim towards better health when we look at our respiratory health. Now, when we talk about the numbers, we notice that it says 350,000, but out of every 100,000 individuals, it is from 40 to 100 people that dies from the coronavirus out of that number. And the reason why this is a little bit tweaked different is because we talk about geographic location. In California, had the highest death rate, 95 out of 100,000 people. So when you're looking at those numbers, that's how we toggle that. That's how we bring that together. When you talk about what the CDC does and how they bring those numbers to life so that you can understand what we're dealing with. Wear your mask. Right now, that's the best deterrent right now. Wear your mask. That's your protective gear. Wear your mask. Always use your sanitizing lotion. Use that stuff because it'll help. It decreases the chances. And it shows that it is effective. All right. Lung disease, number 4. Lung disease falls in 4th place. And let me tell you something. That also contributes when you talk about the coronavirus. You're talking about the coronavirus. Lung disease, that's all respiratory. But it comes in 4th place, nonetheless. I only did 4 because a lot of the rest of them, I'm not going to go down that list. I just want to hit the top 4. Lung disease runs at 149,000 people last year died due to lung disease. Now, we're not talking about whether, corona had a contributing factor or not. We're just saying lung disease. Okay? 50 out of 100,000 people died due to lung disease. These are my statistics just for those 4 major health concerns for 2020. But if you include other concerns that cause a death, then I'm talking about car accidents, you name it. I just want to stick with the medical side of it. But if we look at all of it in America, and if we group everything together, you're looking at a number that range around 2,700,000 people that pass due to the death of something, whether it's firearms or, health issues, you name it. But that's what we lost in 2020. Okay? This is the reason why preventive health measures are important. We need to do our best as individuals to move forward into 2021 and continue to do those little things like doctor checkups, doctor visits, or what have you. Back away from those tobacco products. Excessively drinking alcohol, all of these things that can cause problems. It is important to maintain your health and well-being. It is very important. You can do that through exercise. I know some of the gyms are no longer opening. Some of them have reopened. But depending on how this coronavirus start this year and whether it picks up, be a momentum or not, some of these gyms will stay open. I do not advise you to get into close proximity with people when you're out there doing the gym. You can work out at home. You can turn your TV on. You can do aerobics with whatever, video or what have you, whatever you're doing. There are all kinds of things you can do at home. You can do push-ups. Some people have gyms in their garages. So I'm not saying that whether you can go anywhere or not, because we're talking about adults here. But I'm saying that be careful, because this is how you maintain your health in 2021, and we would love to see those numbers decrease. Dieting. I have 2 videos that talks about diet. You can help yourself a lot by watching and managing what you eat. Your intake, your food intake is very important for 2021. We don't know what is going to happen. 2020 caught us by surprise. And what makes 2020 so different from 2019 or 2018, 2020 is a leap year. That was a leap year. We had 366 days. And that one extra day made a difference. So by it being a leap year, just think about it. The numbers changes. So, preventive health. When we talk about preventative health, we're talking about just what I said, doctor checkups. Calling your physician and saying, hey, listen, I want to make a scheduled appointment because what I want to do is get some blood work done, or I want to get a physical done. Hey, I want to try to work towards you ladies, work towards having a mammogram. Whatever you need to do. Whatever you need to do preventive health. Sleep management is a wonderful thing that you can do. Look at over a week's time. You don't have to start from a Monday and go to a Sunday and try to get as close as you can on calculating how many hours of sleep you get in a day. Because you need to get anywhere from 6 on up, 6 to 8. You need to get that. It's very important that you get proper rest, because your body can function and your mind can function at peak level when you're getting proper rest. So remember, preventive health is one of your best ways to combat poor health. Managing your mental health issues. Those of you that know you have mental health issues, you know that whether you're on medication or whether you're just receiving talk therapy, you need to go and make sure you make your appointments. You need to make sure you take your medication. You need to make sure your medication do not run out, because all of this is important for your mental health management. Mental health is important. There's not much talk about it, but it's very important, and I'm going to be talking more about it this year. Finding ways to relax and unwind is also important and is a very important aspect of our health and well-being. Just finding time to chill out. Sometimes you do so much during the day, it's good to come home, relax, kick your feet up, and don't get into anything else that heavy. Just relax. Calm yourself and relax. Sometimes listening to music is good, for those of you that love music. And then sometimes just grabbing a book, kicking back, and chill. And for a lot of you, some of you just chill. You don't even read a book or nothing, you just relax. Some take a nap. Nothing wrong with that. I also talked about in some of my other videos, eating a variety of health foods can help bring that well-balanced system in your body. So good diet, good nutrition, and good rest is key. It keeps the body working well. It helps prevent diseases, especially when we look at type 2 diabetes, cancer, and cardiovascular diseases. So we're all trying to figure out ways that we can better take care of ourselves. And remember, this is your body we're talking about. So I don't understand for the life of me why we would cut corners and cheat ourselves. Now, I want to move specifically to men and women, starting with the men. Preventative health is, like I said, key. But men need to really focus on getting those doctor visits in more than ever, because men are the type, we like to chill. I don't need no doctor, right? I feel great. That's us. That's what we do. But we need to get away from that, because right now times are critical. Right now we're dealing with a disease right now and a virus. We're dealing with diseases and viruses that right now they don't cut corners. We cut corners, they do not. It's important to include blood pressure checks, prostate examinations, colon examinations, skin checks. Some of us that, for a lot of Caucasians, skin damages due to sun, the UV rays, So you need to make sure that you're getting these checks in. You're going to see your doctor, cholesterol checks, and checking for diabetes. And a lot of people that, they get their exercise in, like I said before. Some people wear bands. I have a band that I wear, and it counts my steps. And I finally got up to 7,000 steps, a little over, a day. And that's when I'm working now. But I try to get those steps in every day that I work, because I don't do too much after, on my days off. So that's paramount. Women, the same thing. But women have other areas, because women's health is totally different from men's health. So preventative care for women, cervical screening tests, STI screening, checkup, especially when you're pregnant. Going to see that OBGYN. Going to see your OBGYN. So you want to make sure that you're getting these checks in. Mammograms to check for breast cancer. Do those health checks. When women reach and hit menopause, then you got to go and think about bone density testing, because you don't want osteoporosis to slip up on you. And here's one I don't hear much people talk about, but it's being talked about, but not as often among women. It's the fecal occult blood test, and they use it. That's like for bowel cancer. So when you see blood in your stool, you need to think about going and get it checked. You want to find out whether or not, you have cancer in that area. These are great things to remember. So I really want you people to understand that we're all in this together, basically. Like they say, we the people of the United States of America, we're in this together. Now I want to move to my next one, and I'm going to wrap it up with this. Managing your mental health issues. That is a topic that is kind of taboo, yet it is a great topic, because when we talk about mental health, a lot of people do not want to talk about family unless it gotten so bad until now we got to go and get someone to check out this. We got to go to the doctor on this. We have to go to the doctor on that. A lot of time people don't deal with mental health until like a loved one end up with Alzheimer's. Well, let me tell you something. Sometimes ADHD is something that carries on not just through childhood and adolescent stages, but it can go into adult stages. And sometimes older adults may have attention deficit hyperactivity disorder, ADHD, and do not realize that the symptoms is such as forgetfulness and disorganization, impulsiveness, easily to be distracted, and difficulty to deal with leisure activities. All these conditions are linked to ADHD. So you need to think about this. See, we are tackling more than just coronavirus. So awareness, healthcare awareness should be prevalent today, especially now in this new year. We should be more aggressive on trying to better our health. When we're talking about ADHD, and it's being common, it's more common among children, because I think it's more noticeable because we pay more attention to kids than we do adults and their behavior. Nonetheless, sometimes in children, they grow out of it. They hit adolescent stages, and then they grow right on out of it. Then some, it continues throughout adolescent and into adulthood. And like I say, seek out professionals. You want to make sure that you talk with mental health practitioners. You want to talk to these professionals, and you want to have an assessment done. You want to know what's the status of my child's behavior. And as an adult, you want to know whether you have some type of mental health issue, because this is big in America. And like I said, I wasn't saying much about it in 2020, but this is a new year, and now I'm moving into it, and I'm going to be talking about a lot of other things as well. And you want your family member or loved one to be able to get the proper treatment. You have psychiatrists and psychologists. You have mental health clinicians, practitioners that are working daily through talk therapy, and sometimes if it takes medication, that psychiatrist will prescribe such. But these are the professionals you need to talk to. I'm sorry, but as much as loved ones and family and people love you, they cannot talk you through this properly. Get with a medical professional in the mental health field. I urge you. It is important. It is imperative. Because the goal of treatment is to help children and adults to improve social relationships, to do better in school, and to be able to function on the job. Because with that, with all of this support, and I'm talking about professionals helping you, when you get that type of support, you can kind of dwindle down or decrease the disruptive or harmful behaviors to the minimum. This is what we're trying to do. Let's work on that. My good people of Rebirth and all of my subscribers, I want to thank you for tuning in. Those of you that have not subscribed, just click on that button down, hit the notification bell, and join me into promoting better health for us all. My name is Robbie Williams, and I want to thank you all for tuning in to Rebirth.